Welcome to the 10th episode of the Guaranteed Analysis. For today's episode, we have a very, very special guest today, Dr. Gary Marshall. Thank you so much for being with us today, Dr. Marshall.
Oh, I'm really looking forward to it. I don't know about that special part, and I'm still not quite sure why you want me to be on your podcast, but I like talking, so I'll say yes anytime.
Oh, amazing. Well, let's give our readers a little bit of background on you. I'll give you a little intro, and then I like when people introduce themselves. I always find that way more interesting than reading off any bios or websites. You are the current vice president of the American Veterinary Medical Association. Is that correct?
Correct.
And you are a former practice owner of a feline practice as well.
Yeah.
Multiple practices?
Yes, I have owned two practices. One was a general practice, and then once I started from scratch a feline practice in the mid '90s, then after a few years of that, I decided somebody should probably do this cat thing okay. And I wasn't there yet, and I didn't know anybody that was really outstanding at it. So I just decided I was just going to do cats from there on out. 30 years almost.
That is absolutely amazing. And you are in the Pacific Northwest currently, correct?
Correct. I am just outside of Seattle, Washington, but this morning we're renovating a little cabin, and it's in the South Sound, so South Puget Sound. And this morning I was distracted by a gray whale swimming by and some harbor seals and some eagles flying over. So the typical, every day in the Pacific Northwest kind of image. I just love it down there. I'm excited to be able to spend more time down there once we get it all fixed up.
Oh, that sounds absolutely delightful, like an absolute dream. I'm on the opposite coast. I'm on the East Coast, just outside of Boston. And my wildlife encounter today was a trash panda. It was a raccoon trying to get into my trash.
Those are great too.
They are, dear. Yeah, and they're very friendly, and he's afraid of me, which is nice. When I was living in Knoxville, Tennessee, they were not afraid of you, and they were
No.
enormous. I literally have to throw things at them to get them off the
Oh,
trash if I needed to put something into the trash. So at least the ones around here, have the appropriate amount of human fear, so they are
good,
less problematic.
good, good.
Excellent. So you also have a podcast, and I absolutely love the name of your podcast. Will you share
Oh.
with our listeners what the name of your podcast is?
The name of the podcast is It Might Get Weird.
That I absolutely love that. I feel like that's kind of my motto in life is leaning into the weird, like leaning into the
Yeah.
discomfort, leaning into the weird, leaning into the hard conversations that I feel really permeate, I would say not even just our profession, but just the shared human experience. And the more that just people in general could lean into being uncomfortable and getting weird, and then the world would be a better place. And I think our profession would even be a better place too. Our clients would feel more seen and heard and
Yeah.
validated, and ultimately result in probably patients getting better care as well. If we were just a little bit more willing to be weird.
Yeah. 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 No, it's a quote from a Pixar movie from Mr. Incredible. When everybody else is running away from trouble, he calls his friend Frozone and said, "Suit up, it might get weird." And then they go in and take on the day. And I kind of look at that sort of like you said with veterinary medicine, where we're the ones that when everybody else is concerned and have a problem and scared of doing stuff or fearful of what's happening with their pets, that we just like, okay, let's go do it. We'll fix the problem. We're the ones.
Absolutely. That is probably, I think, the only series in Pixar that I have not seen yet. My
Oh, they're
children are
great.
4 and 6, so they're little and they're into
Uh,
the newer ones. Although we did just watch Up, which I believe is it
mm,
Pixar's or DreamWorks. I always get scolded because I always get them confused. But
yeah, it's somehow in the Disney world. So I think it is a Pixar.
it's a Pixar one too. That one's also very, very good, although very, very sad.
Hmm.
And I like the dog in that. Doug the dog is
Doug,
is very funny.
he's awesome.
Excellent. And one of the things I love about your social media as well, I love following you on social media.
Oh, thank you.
And I love how you talk a lot about, or even just mention, you're always meeting these really interesting people and forming connections and bringing people together. And it's just such a beautiful message, especially since COVID times and everybody was so isolated. And so I love seeing how you're just really leaning into like bringing people back together and bringing, and I love duality. That's probably what led me to be a nutritionist, is kind of,
Mm.
again, that leaning into that uncomfortable zone that, it's not black, it's not white, it's very gray, of having conversations with people, and you bring together very different people in your conversations, and do that in a way that just feels very seamless.
Oh, well, thank you so much. I feel so fortunate to be able to do what I do and to be able to be in some of the spaces that I get to be in, and it's just so much fun. Every generation, every aspect of the profession, and I think probably the key that allows to be so maybe seem seamless is just because I'm just so curious and I just want to know so much. So, and I'm not afraid to ask people and just go up to people and ask questions and start conversations, and that's usually how everything starts.
That's amazing. So it sounds like you probably were not one of the veterinarians. A lot of our colleagues, they really like it when I come into a conversation with clients because they're like, "Oh, thank goodness I don't have to
Mm,
talk about nutrition anymore." Woo! And then as soon as something uncomfortable comes up in the nutrition conversation, they want to just run out of the room. You strike me as
y-
someone who probably would not be tempted, or maybe you are, be tempted when it comes to nutrition to run out of the room and not want to talk about it.
yeah. Well, another thing about me is I'm definitely not afraid to say that I don't know or to say that I'm wrong about something if something comes up. So, and I've listened to not every episode of your podcast yet, but I've certainly listened to some, and I enjoy them. And I think one thing that I'm so excited to hear you say when you talk about dealing with clients is that you're interviewing them, you're asking them, what they're doing, why they're choosing to do it that way, and then with that information, then you can, like you've said, sort of help go on that pathway towards informed consent. To Yeah, I mean, we're a science industry, but I think we're a service industry too, and so we're there to try to find pathways to help our pets. And to do that, I think we got to know what they want and then help them get there. And so part of that is saying that I don't have an answer, but I know somebody that does, and let's get you in contact with them. And I think they're more willing to take me up on a lot of those recommendations if they perceive that I care and I'm really trying to find that right connection for them. Um, but I'm also, since I've been doing this so long, I am kind of a bit opinionated, and I don't mind telling people it's like, okay, this is the way I see it going, and then you can decide from there what you want to do, and we'll work it together.
Yeah, I don't know if I would imagine that with some of the cats, they have a mind of their own, right? And so there's the way that we as practitioners would like to see an outcome, or have a case go, and the gold standard of medical way that it would go. And
Hmm.
then our patients have different ideas, our clients have different ideas of how that should go. I always joke that, we're all on this cruise ship together, and ultimately the veterinarian and the owner aren't in charge. The captain of that cruise ship is absolutely the animal. And in terms
Yeah,
of cats, they absolutely without question are. Like, the dogs are more willing to be skippers, but the cats, they are fully in charge of
yeah,
are
and
fully in charge of the boat.
and I'm sure your conversations go like this too. It's like, this is what I'd love your cat to eat, but if they choose otherwise, then we'll work from there and we'll decide, what we can work with.
Yeah, yeah, absolutely. And to your point about the interview, I think sometimes what some people lose sight of in choosing what to feed an animal, we have a human factor involved in that. It's
Mm,
not just what we want as scientists and as medical practitioners, trying our best to make the very best of recommendations based on the evidence we have available and our patients' preferences. Also, there's an owner associated with that, and those owners sometimes come with such strong preconceived notions
mhm,
about what is a good food or not a good food, that when we're talking about nutrition, sometimes I teach students or other colleagues that you almost have to approach it with the same respect that you would talking about religion or politics
mhm,
with your client, and
yeah,
just admitting what we do know, what we don't know, what we have the evidence for, what we don't. And then, like you said, evidence, informed consent, and just saying, it sounds like this is really important to you. What are your non-negotiables as the pet guardian and as the one with thumbs and responsible for the life of this either cat or dog. And then just saying, okay, we're going to try to work with you rather than against you. And sometimes it's okay, this is not what I would recommend. And that's how I
Mhm.
say that. Absolutely. And this is not the way that I would steer the boat. This is not the direction I would steer the boat in. We're going against the tide. We've got a lot of things working against us. But I just tell them what the risks are with doing it their way.
Mhm.
And I say, okay, as long as I don't think it poses an imminent risk to the pet, I say, okay, here's what we're going to do. We're going to try it your way for 4 weeks. You're going to recheck with me. If we're not making any progress in that direction, then we're gonna try it my way.
Yeah.
Or if they
Yeah.
seem more amenable to me trying my recommendations and the plan that I would like them to do, then I say, okay, here's what we're gonna do. We're just gonna try it this way for 4 weeks. And if they haven't gained weight or whatever our, quantifiable parameters are, if we haven't met them, then I'll say, okay, then we can try it your way. Or if they just won't eat it, we got to have something quantifiable, because if we
Yeah.
leave it to, qualitative rather than quantitative, then it's, oh, the diet's just not working, and oh, their code is not looking good. And it's like, no, I need something more concrete than that. We
Yeah.
need weight. We need something.
Yeah. And one of those situations that I that that conversation kind of brings to mind is a conversation sometimes about therapeutic feeding, like for using YD in a hyperthyroid cat.
Yeah.
And the conversation can be really, really long. Everybody wants to know what to expect, the science, what's going to happen. And it's like, why don't you just take a little bit home? And if they don't eat it, we just saved a half an hour. If they do eat it, then let's schedule that big long conversation, because I definitely want to educate you on this particular thing. But your cat may choose otherwise, and there's nothing we can do about it if it won't eat it. So we have to go on to a different option at that point. So let's just cut to the chase.
Yeah, absolutely. And that is, I consider YD one of the miracles of modern nutrition. Like, you can completely control an entire disease with food. That's
Yeah.
that's amazing, and Hills has figured that out. Although, like you said, if the cat won't eat it, or we're given treats, with it,
Mhm.
or we need to get medications into the cat, and the cat, won't take it in a marshmallow or something, it
Mhm.
doesn't have a lot of iodine in it.
Yeah. Yeah. So
A
there's
lot of good
always,
all that science does for us, and
yeah.
formulation genius.
Yeah, you gotta take the cat into account on that. But I love that as well. I think it's a great treatment, a great drug almost, even though it's not a drug.
Yep. And that is something that I'm seeing a lot of in the non-scientific side of social media and recommendations, is people really trying to, I don't know what the right adjective is for it. Is it, I try to offer generosity of assumptions for them, and that they are slamming therapeutic diets because I don't understand them. And people
Mm,
usually are afraid of things and come up with a story and, utilize heuristics to make the most simple connection in their brain. And we're told, oh, you don't need to feed a therapeutic diet. Actually, it's a racket. Therapeutic diets are a racket. I
mhm.
heard someone say that. I'm quoting. This is not my opinion. I'm quoting someone saying that.
Yeah.
That therapeutic diets are a racket because there's no medicine in the food. And I
Mhm.
listened to that, and I think I listened to it a few times. I like screenshot it and I played it, and I'm like, well, yeah. I mean, there's not supposed to be. That's not the point. It's managing the disease through the nutrients. Like,
Yeah.
really? Is that what? And looking at the comments underneath, and I think it was a YouTube video, and I was like, and people are like, "Yeah, yeah, absolutely. You don't need that, and you can make your own food at home. It's therapeutic. And it's
Yeah.
whole food will be way more therapeutic than something in a, commercial in a can or in a bag." And it's like,
Yeah.
wow, where do we go wrong with explaining what a therapeutic diet is to the general public?
Yeah. I think maybe in some of the clients that I have too, that especially if it's a first time therapeutic diet for somebody, you get the conversation a lot. Well, we just got old Roy and fed it to our dog out in the back porch for 20 years, and he did just fine. And now you want to charge how much for food, and it's supposed to do
Right.
something special. So I think there's some uh, ignorance that you have to get by with just more education. And unfortunately, that just takes time and compassion and kind of figuring out what they're going through. And it's hard to do that nowadays. And especially, being paid on production or this or that, and the next one's waiting, that I can see where a lot of clients are frustrated with that. And they got a lot of time in the middle of the night on Google And so
Oh,
it's
yeah.
like I'll just ask Google and it'll never tell me they need to move on to another appointment. And I don't know how we get around that, but I think utilizing staff, well-educated staff, to field a lot of those questions, so they're not quite so tempted to go to Google and do their research, is maybe a way to at least get them to the point where you can focus on education for them. And that's what I've tried to do with my clients for years. And I've been fortunate. We're my practice is in a very affluent area and really super caring clients. And we're just dealing with the crazy cat people, but they love their cats,
Amazing.
and I love to help them with their cats.
They're so dedicated.
Yes.
It makes, I would say, it makes our job so much easier because they're just so on top of things and so compliant and just so carefully tracking, and they know when their cat's not, urinating, even like a
Mm.
meal or two normally, that, oh, they're underproducing their urine, or I'm testing the pH, or
Yeah.
so many things. Or they're not scratching as long as they usually scratch, or they're chittering longer at the bird outside. I think they're stressed, and or maybe they're happier because they're chittering longer, and they
Yes.
notice those things, and it's so
And then
wonderful
And then I
to be
think,
able to,
man,
yeah,
I don't care about my cat nearly as much as they do. When I'm not doing all these things, it's like I just get home, it's like, "Oh, yeah, I'm tired." Yeah, and they come
yep.
sit on my lap, and that's good, and other than that, it's whew, those guys are monitoring so closely, and I do not do that.
Absolutely. I think that's probably the case. Although it was interesting is I pulled that on Instagram. Is I asked, because I have about approximately, I don't know for sure, but I think it's about 50-50 with pet guardians and veterinary
Mhm.
professionals. And I'm absolutely, and I have always been, even before I had my own human primate children that I'm responsible for, even with my own four-legged for children, I was very much like the cobbler's children have no shoes. And even
Yeah.
though I, was a nutritionist and I do rehab and acupuncture and all of these kind of evidence-based integrative modalities, and people say, "Oh my goodness, your animals are so lucky. You get home and they must get massages and acupuncture and all," and I'm like, "Nope." And like, "Oh, and because you're very open-minded and integrative, you must make your own food." I'm like, "Oh, absolutely not." No, I
Who's
don't.
got time for that? No.
I really have the time to,
Yeah.
make myself 3 square meals a day, never mind, and make my dog's food. And then people were always like, "Oh," kind of taken aback that, "Oh, no." I'm like, "No, your animal absolutely has some better quality of life at home than
Yeah,
mine do." I like mine a lot, but
I did hear your question for your listeners on what type of feeding you do for your pets, and I want to guess. I didn't hear the answer if you've posted it yet, but I want to guess that Kim does make food for her, prepare food for her pets. Is that true, or is she out of the bag or out
oh,
of the can?
Um, well, she has a newborn at home right now, so I think right now
Oh,
she is out of the
yeah.
bag and out of the can. I had a technician that worked with me that was 100% homemade, and
Wow.
she was the best to give actually so many of my tips and tricks for helping people prepare the food in a way that doesn't eat up their entire lives is because of
Mm,
her. She came up with the
wow.
idea of throwing the sweet potato in the microwave for a minute or 2 first, and, poking it first with the
Mhm.
we didn't tell someone to do that once, and they exploded
Oh,
in the microwave, and they got really upset with us. And then you put it in the in the oven, and then also telling people, like, "Just scoop it out with a spoon, like, you don't need to be peeling it first, that takes way
yeah.
too much time. Just literally poke it, stick it in the microwave, 4 minutes, then stick it in the oven for the rest of the time till it's soft, and then just scoop it right out," and it dramatically cuts down the prep time. And my own dogs get a mixture of everything. It's pretty much kind of whoever I'm consulting with at the moment, and first I try it out on my own dogs and see how they do,
Yeah.
and then just kind of mix it up for them, 'cause
Yeah.
I'm very much in the camp of we have no idea what the best option is, and there are a lot of great evidence-based companies out there that are doing a good job, and they all formulate so differently, and they
Yeah.
formulate based on their own philosophies. It's not that always it used to upset me. It doesn't upset me anymore, but when I was younger in my career, it would upset me when people would insult the pet food companies because I know the people that work there.
Mhm.
They're my good friends, and so when they were insulting them and calling them shills, I mean, I get called a shill all the time, so I don't take it personally, but I'd rather somebody insult me than somebody I care about. Um, and say, oh, well, they're only doing that to make money, or they're only packing it full of fillers, or to your point about the therapeutic diets. And, well, why are they so expensive when they're mostly X, Y, Z ingredient corn? I don't know, whatever they want to be vilifying at the moment. And understanding the amount of science and research and quality control that goes into that product that very much affects the cost of that product, and that company formulates to that philosophy because that's truly what they believe is the
Yeah.
best for dogs and cats. They want them to live a long, not forever, a long time with a good quality of life. And that's what they're trying to do too. They're not trying to make them unhealthy to sell more pet food. That's absolutely not happening.
Yeah. I think that's a good point as far as the philosophies, because these companies are run by people and people have different philosophies. So even if they're all looking at the same research, they may come up with a different, like, oh, let's really focus in on this part of it and see where that goes. And so I agree with you completely that they're all great. They're all trying to help animals. They're all trying to stay in business,
Yep.
and it's that is one thing. By thinking back over 30 years of practice, 35, that the quality of nutrition and the options that we have and stuff like that. There's a lot of confusion, but there's so many amazing options out there for us to use that's just one of the hugest things that I've seen that's been such a big benefit over the years that I've been practicing.
Absolutely. Yes, absolutely. And what did you find when you were in practice was your biggest nutritional challenge for your
Mm.
patients?
Maybe you can help me with this one, because there may be a you might have an idea on if there's any truth to this, if there's any benefit to it, or if it's just like whatever, that cats are just do what they want to do. Because like I said, I'm kind of in an affluent area, so we see a lot of Bengals, and there's a couple Bengal breeders that think we're like the best place to send their cats. So they'll come from even those will come from quite a ways, and I love working with Bengals because they're kind of just they want to come in and they just want to flip you off and then say, yeah, try it.
So do you have
And
scars up and down your arms from the bangles?
no, I think I speak Bengal pretty well. So yeah, anyway, I love dealing with Bengals, and I like dealing with most Bengal owners, except for the ones that just saw a picture of them on Instagram and thought they were pretty and they should get one, because that's not going to work. But um, so many of my kitten Bengals just have horrible diarrhea. And but they don't seem to care. It's like and it's like once a day or twice a day bowel movement, so it's not urgency or anything like that. And if we do uh some worming, we do some fecal testing, some other stuff, and it's like, yeah, everything seems fine. They're growing well, they're acting great. I usually end up telling them it's like 9 months, 12 months. If you can hang out that long, it's going to be fine. I don't know why it is, but it usually just is that way. But I do have some that they probably listen to somebody else or do these other things, and they say, well, I can't take it anymore. And so they start feeding raw food, and it gets better in a lot of these really quickly. And so when I was listening to your podcast about the probiotics or the biodiversity of their gut biome, I was thinking, oh my gosh, I wonder if that has anything to do with why they're getting better, or if it's just still timing or just luck or what. But do you counsel any Bengal owners on their kitten diarrhea?
Yes, and actually, it's interesting to see that. I find that the Bengals are the least predictable in how they
Mm.
respond to the kitten Bengals, and some of
Thank you.
them, yes,
I feel
absolutely,
seen.
they are. They're just very unpredictable, and usually I tell that to clients when they come in and talk to me, and I say, we're gonna try a few different things because I don't know why your kitten's having diarrhea, and I do feel like traditionally with diarrhea, definitely with dogs and even some with cats, I like adding fiber into their diet. I feel like even cats, even though they're not supposed to work that way, um,
Why not?
physiologically, yeah, we just add a little bit of fiber and not a lot, and that often just chef's kiss just gets them right as rain. And There was not. I used to really love, it doesn't exist anymore, and I, like, still cry myself to sleep sometimes at night because it doesn't exist anymore, but it was Imes low res feline
Oh,
diet was, like, I love that for everything, like post-op, you know enteropathy
mhm.
dogs and cats, and it had just a perfect blend of fiber, and it was super highly digestible still. It wasn't, even though it had higher fiber levels, it didn't affect the digestibility of any of the other nutrients, and they just formulated it so well. So when I'm having a Bengal kitten that's not responding well or the way I think it should, first I say, okay, first what we're going to do is just try some fiber. And sometimes I don't even necessarily switch them off their current diet. I just have them try adding. And I'm not a big psyllium person. I find that with
Hmm,
psyllium and Metamucil that sometimes it would work great and sometimes it wouldn't. I like using mixed fiber profiles better. And I know that psyllium technically has mixed, but I like even more of a mixed fiber
oh,
profile. And
interesting.
so I used to make my own concoction
Oh,
in
wow.
the kitchen of the hospitals until one day my supervisor pulled me aside and was like, Danielle, there's white powder everywhere, and you're like messing with the white powder on the gram scales, and people are starting to ask questions. And is there any way that we could do this maybe
Uh,
just after hours? Like, can we put a sign on the door, even like explaining what you're doing, so that it's like in Breaking Bad. It was like an episode of
yeah.
Breaking Bad, and
Wow.
especially if I drop things, and then like there was like banging coming from the kitchen too. But I found a product that had a nice blend, so I stopped having to concoct
Mhm.
my own fibers for the cats to respond to. I also actually found some of them did well on a hydrolyzed diet
Mm,
too. And
yeah.
I don't know. And this is where the companies are always changing it. And some of them are for all life stages and some of them they're
Oh.
not. So I always have to, like, every year or every 6 months, not even every year, I have
Mhm.
to sit down and go, okay, what are my hydrolyzed or novel protein growth options right now,
Yeah.
currently? Because sometimes a hydrolyzed diet worked really well for them. Or if none of that was working, then I would try something very, very highly digestible. And I would ask people,
Mhm.
what are your thoughts on doing a homemade diet? And,
Yeah.
several years ago, there was no safe raw option, even though that's what people wanted to do. And so I would have them even just cook up meat and add a vitamin mineral supplement. And then we would kind of titrate in and add a little bit of fiber to it and kind of find that happy medium mix. But a lot of those Bengal kittens
Mm.
they just wanted meat and
Yep.
vitamins and minerals. And they did chef's kiss beautifully on them.
They do
And
great.
I had to eat a whole lot of crow because they were having even large bowel diarrhea signs that were not responding to fiber or was responding to low
Yeah.
res, very gently cooked. And what was wild is I would, and it's made me really kind of rethink. Cats really made me rethink my nutrition approaches. Dogs were a
Mm.
little bit more predictable, but the cats didn't follow the rules. I don't feel like they follow the
Mm.
rules on anything, and they don't follow the rules on nutrition either. And there's what's in our textbooks and what we're taught and what the research has shown. And then there's your feline patient that walks in and is like, yeah, nope, that's not going to work for me. And you have to be a lot more creative because they have a
Yeah.
lot more texture preferences. They're usually a lot pickier, cats and toy poodles,
Oh,
a lot
toy
pickier
poodles.
in what
Mm.
they'll eat. Now we have more options on fresh and fresh for cats. So I'm very grateful for those companies that
Yeah,
have
there's
made those. We have
so
options
many options. And one of the other things that I don't know if it's like a it's not really a pet peeve or anything, but something that comes up that just takes more time, but I really enjoy educating people on is when you're talking about the all life stages and just
now.
going through the AFCO label and showing them, okay, because if they're, if they've got a 2-year-old cat that is or a 3-year-old cat that is just obese and it's like, well, we haven't done anything differently, what's going on? It's like, bring me the food. And if it's like, no, it's not a kitten food, well, if it says all life stages, that means it's a kitten food, and it's just
Right.
got a lot more fat in it than your cat that's sitting on the couch at home needs anymore. So we need to find something different. But they're I don't feel that they're told anything like that when they go to the pet store, as far as to be cautious about and all life stages, when they're an adult cat. And I get concerned about that. I don't know if you do, but I
Oh,
see a lot of fat cats that I think that's a big reason for it.
I am not a fan of all life stage formulations for the most part. I understand why pet food companies do it that way because it's hard to cater to the masses and, formulate the quote ideal diet to the masses rather than the
Mhm.
individual cat, which is why I think doing, individual consults and individual formulations is so much more
Oh, I
rewarding
bet.
than trying to find a mass diet that works for everyone. But yeah, to your point, exactly. And I'm also when it's in all life stages and people don't realize this is it's formulated to the trickiest to balance or trickiest needs to
Oh,
meet, most demanding needs to meet life stage, and that's the growth life stage.
yeah,
So it's going to have a whole lot more minerals, a whole lot more vitamins than your adult cat would need. And in talking about what is one of the most common chronic diseases that affect cats and what organ system, kidneys. And
yeah.
so feeding an adult
All that
cat
phosphorus.
a phosphorus, and usually it's an inorganic added phosphorus because you need such a high phosphorus content for a kitten that usually companies add inorganic phosphorus in addition to the organic phosphorus coming from the meat. So they add extra inorganic phosphorus, which we now know is the hardest on their kidneys. And so I'm really not an all
Yeah.
life stages fan for specifically senior animals, even kind of late
Oh,
stage
yeah,
adults, but and especially
yeah.
for cats.
Wouldn't it be great if they had, on the barcode, like if you're when you go to the grocery store and it comes up and it's like you need to show your ID to buy, some alcohol or even just a cough medicine or something. Wouldn't it be great if it scanned up and said, "Oh, do you have a do you have a cat that's older than 9 months
Yeah,
old? Sorry, you can't
right.
have this."
Sorry, or
Wouldn't
is
that be
your
great?
animal overweight? Because
Yeah.
I don't know how often you were asked about this or still are, but the two things that I get the most heat for when I talk about is when I say that a kibble diet isn't necessarily harming a otherwise healthy
Mhm.
cat. I catch so much flack for that,
I
even from
bet
fellow
you do.
veterinarians, and being like, "Well, show me the show me your references and show me your resources." It's like, Show me the opposite. Where did you hear? It's
Yeah.
pure dogma when we've seen that. Oh, cats have to be eating a wet diet, or we're going to give them diseases. It's like no. It's like saying we're going to give an animal kidney disease by feeding high protein. No,
Yeah.
when there is a disease process there that warrants a high moisture intake, then we do that. But in the meantime, we don't. It's not necessarily causing a problem as long as the cat's going to drink
Yeah.
normally.
Yeah. And that's a good point too, because I that's one part out of a lot of different parts of veterinary medicine where there's a few things that we're pretty good at shaming each other on how we practice, right? And
Yeah,
that's, I think, one of them, and that's just bad. And it's like, let's have a conversation and say, okay, well, why do you do that, instead of saying, oh, you're horrible.
right, right.
And then we can learn more, I think, if we just say, huh, that's not the way I do it. Why do you do it that way instead of the other way around?
Yeah, and having more of a conversation about it, or and I don't know what your opinions are, but whenever I have a tricky case, feline, I my go to like what I could come back to before I like throw my hands up and I'm like, I don't know what's happening, is and before I like put usually I like phone a friend. You like phone an internist. Usually I'm like, okay, now we need to go talk to and you need to have an appointment with the internist because we got to get some more answers or a diagnosis or something. But usually I can, very patient clients that are willing to try different things and we slowly change one thing at a time and dial in the optimal plan for their cat. What I usually will go to is the mouse in a can diet. I feel like
Oh,
that, like
yes.
the mouse in a can, and that is where I'm very interested in seeing more research in is that the optimal diet for cats?
Yeah.
Most
Well,
cats, some cats. I don't know what the
yeah.
answer.
And you've seen, I mean, all these changes in nutrition over the years, and raw foods, fresh foods are super, super big now and stuff like that. Do you think we'll ever have a company brave enough to have, like rodent diet or songbird diet for
Oh.
cats and just throw it in a can or
I
something?
know,
The marketing is difficult,
it
but
it is,
but pe-
although I let's see, when I first started getting into nutrition, that was 12 years ago now that I think I did my research study, and it was on the environmental sustainability of pet foods. And it
Mm,
was
wow,
it was the peak of the rise of like ancestral feeding was just starting to gain popularity and grain free feeding was just starting to gain popularity. And I was in my internship and I felt like every other animal that came in through the ER had diarrhea and was on a grain free diet and usually had like
mhm,
just switched to the grain free diet or hadn't been on it for that long and was having massive diarrhea. And I just like, what is appealing about this? Like,
yeah,
and are people not thinking about the impact of the environment on what we're feeding our pets and competing with the human food chain. And so trying to get people to think about that a little bit more and think about how it impacts the environment. And so I would give a whole presentation about it. I did a research project on it, and I would throw up as a joke. I'd call it EWD, and it was the earthworm diet. And so I took a Hills
Oh,
bag and I like put a little worm on it, and I like did some Photoshop magic. Um, and people, even like colleagues, would like the gasp, like, "Oh, that's so disgusting! And how could we do that? And that's so
oh my
gross!" And
gosh.
so like I couldn't get. And I would, when I have conversations or consult with pet food companies, I'm like, "Come on, somebody do this! Somebody do this! We need some more like, or how about mice? Like mice, it'd be a lot easier to farm and, like keep them in, way easier and way better for the environment." And at the time, people were like, "Oh no." And the companies were like, "There's no way we can market that. There's no way that we
Yeah,
can market that." I'm like, "Sure you could. You throw up a starving child and be like, 'Are you comfortable taking the food out of this kid's mouth to put
yeah,
in,' like, here, I mean,
yeah.
your dog or cat would be delighted to eat an earthworm or a mouse." Like, yeah, that's how you market it. And now it's exciting to see that there are so many more insect-based diets out there. So I think that the mouse in a can, I keep throwing it out there in hopes that someone will take me up on it
Yep.
because I have less than zero interest in ever starting or in my own pet food company or formula. Like, I've, seen the insides too much that of that beast that I don't want that to be my responsibility to run and keep a
Yeah.
entire safe the safety and quality control that goes into that. But I so badly, and I actually think that Tiki and Tiki Vet, their whole line of Tiki
Mhm.
Vet is probably the closest that we have to mouse in a can. That and Smalls. Smalls is doing some exciting things, and both companies are doing a lot of research too. They're going to invest in a lot of research, which is so important to answer some of those questions. Because right now we just don't know, and I always say that
Mm.
we don't know what the best thing is to feed, and a lot of people have a lot of really good reasons not to feed canned food. And there's nothing wrong with kibble. And I don't
Yeah,
ever want somebody to not adopt a cat and get a cat out of a shelter because they can't afford to feed or
sure.
won't. There's lots of good reasons why
Oh,
they
yeah.
can't or won't, because they can't feed a canned food diet. So that's always my stance is we don't know if we haven't shown it's harmful. We don't know what the best way to feed is yet. And I get pretty spicy when people start to kibble shame.
Yeah. No, I agree with you, and I've always had kibble in my hospital, even though, like, some associates that I've had in my clinic have, like, "How can we do this? We need to only let people put canned food into their cats." It's like, well, what if they don't eat it? Because if they started out with kibble, and they're like you were talking about the texture stuff, they just may like that's like, "That is not food. I'm not going to do that, and I'm gonna push it off the counter."
Yeah.
and and be done with it. So yeah, we need to have options available. Um, but
And you've probably heard some colleagues say like, "Oh, well, we wouldn't have cats with, FIC and they wouldn't
mm,
obstruct if, just so simple." Like, right? It's always just so simple. If they just were on a wet food diet. And I'm like,
yeah,
I'm that's just not accurate. Like,
yeah,
I see a lot of integrative. I'm integrative, very open minded. I see a lot of fresh fed cats, a lot of raw fed cats that still get blocked, that still have
yeah,
FIC. If
oh
it was
yeah,
that simple,
yeah. And
wouldn't we
I
all be doing
don't.
it by now?
You may know the answer to this, but I can't say that I've seen in healthy cats, adult cats, that feeding that I've been able to pick up a difference in feeding just dry or just canned and seeing a significant difference in urine specific gravity if they're healthy.
Yeah.
And so it's like if they're not dehydrated, kidneys are functioning okay, they're figuring it out, and I'm okay with that. I think canned food is great, more moisture because it's hard to get it's hard to get moisture into cats anyway because they're so lazy
Yeah.
about like walking 4 more extra steps and drinking some water. But if not, then got to do what you got to do.
Yeah, absolutely. And I completely agree. I can't tell looking at the cat, doing a physical exam, looking at their blood work, looking at their mucous membranes, tending their skin. I can't. I wouldn't be able to tell unless I'd already asked them if the cat was eating just can
Hmm.
exclusively or dry exclusively. And especially because there are so many cats that you say some they're kind of on the opposite end of the spectrum, right? There's some that are just really just lazy and don't want to get up, and then there are cats that love water and like
Hmm.
playing
Oh
in the
yeah,
water. Love, you can't keep them out of your glass of water when
yeah,
you're drinking it yourself, and they're trying to like play in the toilet and jump into the shower with me. I had a cat that would like try to jump into the shower with me. I'd have to like kick her out of the bathroom because she would try to like literally jump into the shower with
Uh,
me and play. And then of course she would like zoom out of the bathroom
yeah.
and get the house all wet. And um,
That sounds like puppy behavior.
yes, yeah, she was. She grew out of it eventually, but when she was young, for like the first 3 years of her life, she was a terror, an absolute terror.
And you loved her very much.
I did, yes. She probably was one of my favorite cats of all times. You know, she
Yeah.
destroyed so many curtains, and anything vertical was just scaling in the house and
Oh,
caused so much trouble, and would attack your feet in the middle of the night if you dared to move. She was that cat too, very high prey drive, and um, yeah, I miss that cat a lot. But I
yeah.
never worried about her being hydrated because she was so water
Water
motivated.
focus. Yeah.
Yeah,
That's great.
and like I said, when people ask me about it, I say it's a good idea, especially as a kitten, to get them exposed to different preferences and textures, and so that way someday when if and when, usually when they develop a disease that would benefit from having more hydration or better hydration status, or even as they get older too. I feel like as they get older, they just want to sleep more, so they're not going to get up and get to the water bowl as often as they would. So probably getting them on and also they tend to get constipated more, and so
Hmm.
having more moisture is just a really good idea for older cats. But if they've never been exposed to canned when they were younger, probably going to be not going to happen. They're not
Yeah.
going to switch from their crunchies to the canned at that stage of
Very,
their life.
very rarely. Yeah.
So exposing them to different types of foods young, and so they don't form that preference, that texture preference, is a great idea early on. But I don't tell people don't feed
Hmm.
kibble. Um, and then the other one was carbs, cats and carbs.
Oh, yeah.
Did
That
you or
that
do you hear that a lot still?
well, that's why I ask, um, when people say that they want to do a grain-free diet or something like that, that is
Mhm.
like, well, why do you want to do that? And a lot of times it is that they feel like it's going to be lower in carbohydrates. And I say, well, you know what's not a grain is beets and potatoes or whatever the heck else they're putting in it. And so you're spending a lot more money and you're not actually accomplishing the thing you want to accomplish, and it's really not that important of a goal to accomplish in cats anyway. So instead of just saying stop feeding that, let's do this, explaining to people and educating if that's why they're choosing it. And they may say, I've tried everything and this is the only thing my cat will eat, and it's like, more power to you, go for it. but
Yeah.
but if that's one where we need a conversation, like you say, the interview, and say, what are you doing and why are you choosing to do it this way? And sometimes it's like, okay, go for it. Other times it's like, okay, we need to have a talk.
Yeah, yeah, a little bit more of a where did you hear that, and why are you interested in that, and where
Hmm.
how'd you pick this up? And sometimes it's oh, I don't know, it just the package looked good, or oh,
Right.
my neighbor said it was the next greatest food, or their cat loved it, or something. There's always a reason. It's just
Yeah.
sometimes it's
That's
oh,
not a good
okay, yeah,
reason.
no, yeah, sometimes not a good one, or it's oh, well, they're obligate carnivores and they shouldn't be eating. They have no biological need for carbohydrates, and it's like, well, just because they don't need them doesn't mean they're not
Yeah.
beneficial. And that's actually a newsletter that I'm working on
Oh,
blog post. I'll have a blog eventually too. I'm compiling all these things and a community. Actually, I want to build a community for
cool.
pet guardians and veterinary professionals as well, and just put all these resources out there for them on just because it's not a requirement doesn't mean it's harmful, and actually may be helpful. And then talk about all the things like beta glucans and beta carotenes and flavonoids and antioxidants. And would
Hmm.
anybody argue that any of these things are harmful for cats? And no, they're great. And well, guess where they come from? They come from
Yeah.
carbohydrates. So we want to talk
Yeah.
about how terrible carbohydrates are for cats. It's really, we've got your cat on a mushroom supplement and get them to live forever. And oh, well, mushrooms are carbs, so
Yeah.
you want to talk about starches. Okay, maybe we can have more of a nuanced conversation about starches, but also, and the body's really good at doing what it does, and it's
Converting things. Yeah.
really good to convert things. The body needs glucose, and it's going to get
Yeah.
glucose somehow. And cats are really good at doing reverse gluconeogenesis, but that doesn't mean their body needs to
Right.
only get glucose that way.
Hmm.
That's harmful to get glucose the good old fashioned way
Yeah.
from carbs
Yeah.
or Yeah, so
Yeah.
that is still something that and there was somebody that was just really bent on arguing with me about it. And I won't. I just,
Yeah.
put the facts out there, and if they wanna have arguments with themselves, I let them. If they get rude, they get, blocked, but
Yeah.
if they don't get rude, it's okay, then don't.
Yeah.
That's the other point that I don't understand about social media is, okay, you don't wanna feed your cat carbs? Don't. Great, don't.
Yeah.
Why do we need to talk everybody else into not
Yeah.
doing it too? Like, I don't
Yeah.
understand that.
And there's probably a lot of people that are complaining about how things are done, and they don't even own a cat or a dog, or care for a cat or a dog. But um and that brings up that I do, I mean, I've been doing this a long time, so we slip into other terminology, but I love your phrase, pet guardian, and how you utilize that. And I for I think in my first marketing, when I did my cat clinic in the 90s, we use the term cat caretaker for everything.
Oh,
It
I love that.
alliterates, and it was just a different way of looking at it. But I think it's great. I like that you use that term.
Oh, thank you. Yeah, I like, it was the AVMA that was very
Hmm.
against using the term parent. And I agree because I don't think that doesn't do the pet any good when we over anthropomorphize them and maybe even, you know, pathologically treat them as like it gets a little that gets a little murky, that water. So I very much like they're part of our family. We want to do the very best we can for them. We love them. We love them for who they are.
And it's
And they
our
are
job to take care of them.
yeah, their
Yeah.
dog or cat, we're their guardian. We're their guardian, we're their steward through
Hmm.
this life, and we have the thumb, so they're dependent on us to do a lot for them, but, don't lose sight of the fact that they are and I do think that that's funny is when I like to have those conversations and debates, if you will, with people. I did a lot of philosophy in undergrad, and so I like to
Mm.
have those kind of philosophical debates of, people are so quick to use a heuristic or a logical fallacy, or especially return to nature when, oh, well, we're gonna feed the dog like a wolf. But then they're like, oh, but they sleep in my bed and I dress them
And
in a
they're
pink tutu. And it's like,
yeah. Pick
what?
and choose. Pick
Yeah,
and
right.
choose.
Like pick and choose. Like, why do we need to feed them like a wolf, but dress them like a toddler? Like a what is not even a toddler, like a what are those like pageant queen children?
There
Like
you
what
go.
are
Yeah.
why are we like if let's be consistent. Like if that's gonna be
Yes.
your view on how you take care of your pet, at least be consistent on it across the board.
Yeah. At least in the no clothes thing. I mean, if they're a wolf, the no clothes, you're gonna have to not put any clothes on them.
Exactly. Or I used to say to clients, and I got pretty good with my delivery on this, so people, didn't think I was being condescending to them. But when people are interested in
Mm.
the ancestral based feeding, I would say, awesome. I'm so excited you're interested in this. Okay, here's what we're going to do. We're going to go take Fluffy or Fido. We're going to go drop them in. Independent. I've lived a lot of different places around the country for my training. So it was Tennessee was the Smoky Mountains, and Wisconsin, it was just, out in the Badlands area. We're going to go drop them out in the middle of the wilderness. And they're going to have to not only survive, we're going to put a GPS collar on them so we keep track of them, and they're going to be out there for at least 3 days, and they can't lose weight, and they've got to maintain their blood parameters, and they've got to feel good and look good, and they can't look bedraggled. And if they come back and all those parameters have been met, then yes, I will in not only support you, but I will advocate for this like
Yeah.
style of feeding for your animal. And people would be like, well,
That's
that's
not
the
gonna
most
happen.
ridiculous thing I've ever heard. Why would you even
Uh,
suggest that? And I would go, well, then why are you
mm,
interested in the ancestral feeding then? If if you think that that's
mhm.
best, and
Yeah.
that was a good way to kind of break the ice and them to be like, oh, maybe that's not the best thing. It's like,
Mm.
nope, it sounds convincing. It's a heuristic. It's a way to our brain to try to simplify a very complex topic, but it's
Mhm.
definitely not not the optimal thing
Yeah.
for your
I
pet. Probably,
I
probably, unless they
yeah.
could do those things
Yeah.
and thrive in that situation. Then sure, I'd be willing to eat lots of crow.
Yeah. I do something a little bit similar to that when people are talking about, um, raw food for my pets. And again, like you said, there was used to be not as many options out there, as much science, as much companies that were really investing in good research and those types of things. But and say, yeah, we're feeding raw diet, or want to do this or that, and they're doing really well. And it's like, that's great. Yeah, your pets usually handle it really quite well unless there's some problems. But how do you have two kitchens? Do you have a whole different set of cooking and bowls and utensils that you use for those, so you don't have any contamination with any of the stuff that you use for eating and stuff like that? And then like, well, why should I do that? It's like, well, your cat may handle it a little bit better, but you may not. If there is some extra contamination or extra bacterial growth or something like that, I just don't want you to get sick. So then that gets them to thinking a little bit more, or at least be conscientious about how they're doing it, and it's serious business, and they need to take some
Yeah.
extra precautions, and it might be a little extra work, and they don't a lot of times they don't like extra work, but sometimes they do.
Right, exactly. They may not feel so strongly about it when you have that discussion and talk about the risk, yeah, because
Hmm.
so many people hear that there is no risk to it and that,
Hmm.
oh, dogs and cats don't get salmonella, which just really boils my blood
Wow.
because we've had patients die from
Yes.
bacterial foodborne infections, and it absolutely does happen and takes lives. And people need to be aware of that and that it does happen. And it may be, I wouldn't even say rare. It may be not as common as it would be if you or I were to eat an exclusively raw meat-based
Oh my
diet. I
god,
think
could you imagine?
it would, take out way more people than it does dogs or cats,
Hmm.
and it still has a risk, and
Yeah.
still people need to be prepared for that and keep in mind that if they have any immunocompromised people in their
Right.
home, and this isn't so much an issue for cat guardians, but dog guardians, it's also thinking about being very vigilant about picking up their dog's poop when they're out for walks, and if if their dog poops in someone's yard that's immunocompromised, or if they go to the dog park and
Hmm.
they interact with dogs that are on chemotherapy, that absolutely is an immunosuppressed individual that is more likely to fall ill to foodborne illness. And people don't even think about outside of themselves
Right.
and their pet. Like it's definitely a risk factor, not only for them, increased risk, but it's a risk factor for everyone that they interact with as well. Or, as parents, like if you have children coming over your house from,
Right.
you probably should let those parents know, or put the animal away in a kennel or in a different room, or
Yeah.
it's just
Yeah,
yeah.
no, it's there's just more consequences than just putting food in a bowl for your pet, and because we're exposed to it as
Yep.
well if it's in our home and in our yards, like you said. So it's just education, and like you said, of evaluating the risks.
Yeah, absolutely. And we've had such an amazing conversation. Before we have to end our time together, were there any questions that you had, or you feel like we didn't cover, or
Maybe this will be a quick one, maybe not, but how did you and Kim decide to put all the energy and effort into doing a podcast together?
she wrote me into it? I am really trying to build um, a a service that supports my colleagues in having more of these nuanced conversations in the clinic, because I've seen, I've experience in industry in the real world of GP, and in the academia ivory tower, and then
Hmm.
specialty practice. Those are all very unique beasts, and I've seen the pain that my GP colleagues are in, and I understand, that 2003 AHA study, and we've had studies since then talking about how we're just maybe missing the boat on having these nutrition conversations, and why so many pet guardians are going to get unqualified sources of nutrition advice, because they really don't feel and perceive as though they're receiving that in the clinic. And I understand why. It's time. There's so many good reasons there. Our colleagues are not able to really get
Hmm.
in and do the depth and detail. So my passion project really is helping to educate and support colleagues and assign a nutrition champion in the practice. And I would come in and say to my colleagues, I'll help them, I'll train them. You can have as little or as much involvement as you want. I'll show you how to do it. I'll teach you how to do it. If you want, I'll show you how to monetize it and have it benefit all areas of your practice, so that it's not just a financial or a time drain. You can actually, it can improve the health and improve the EBIT of your practice through utilizing good nutrition. We can lower COGS and increase EBIT. I have enough industry
Yep.
experience that I
Yep.
can I can use those words too. So that really has been my passion project, of trying to kind of change the industry and change the way that we've kind of been educated to have these conversations, and spend a little bit more time, has been really hard.
It
And
is. Yeah.
so Kim came to me and was like, I really want to do this podcast. Um, And I was like, yeah, I would love to do a podcast. I have a theater background. I love,
Hmm.
I love to educate. I love to, perform, but not in a weird way, in a like get up and educate kind of a way. So a
The
podcast
jazz
was,
hands way.
da I very much enjoy that aspect. And so a podcast was maybe on my 5-10 year plan, but it definitely was not in my 6 month or 2 year plan as I was trying to kind of get these
Hmm.
services out and start this and kind of, I call it the fear free of veterinary nutrition. I really hope that I don't get sued for saying that. We're trying to build
You
that and get
might.
that
You
going.
might.
Not that I might. I'm going to be careful. I'm definitely not going to put it on the website.
Yeah.
And, I'll talk to Dr. Becker and
There
see
you
if he
go.
wouldn't mind my like putting it out there on the podcast. But, and so when Kim came to me, I was like, absolutely not. I can't right now. And she's like, well, I'll do it. I'll do it. I'll do all the work. I'll get it out there. And like, you'll just have to show up and talk. And I was like, okay, if all I have to do is show up and talk, then I'm in. 'Cause I
I'm
love
talking.
improv too. So
Yeah.
I enjoy very much just the surprise of it all. And in CE talks, I very rarely have a CE venue that will let me do this, but I love the choose your own adventure where I just get up
Mm-hmm.
there and I put up there and I love my polls and interaction. So I have a poll and I ask the participants what they want to talk about that day. And I have, 4 or 5 options and they pick and whatever gets the most votes is what we what we talk about that day. But yeah, that makes CE companies, sweat bullets when I'm really like, how did that even happen? It's like, well, you probably have
Yeah.
to get the race approval
I
for
bet
each
that.
one of them. And
Oh boy, yeah. I bet that'd be great though. I'd love coming to a talk like that. So.
it was fun. The only times I've done it is when there was not, or, we actually did one time we got the CE after the fact and it was talks.
Mm.
They're all talks that have been race approved before. And there's nothing, wild or outlandish. It's all, pretty common nutrition CE topics. And so, it's not hard to get. So we've gotten it after the fact and said like CE pending.
Mm-hmm.
Or if they're already, a lot of them, they're already CE approved,
Mm-hmm.
vendors. So it's really easy for them to get race approval rather than getting it from scratch. So some of them are like, oh, yeah, we can do this. But then most of them are like, no, that sounds like a logistical nightmare. No, just pick one.
Yeah.
Just pick one
No,
and we'll
I get that.
advertise it. But then I
Yeah.
also heard, and I would love, your input on this, is that um, I was told, and I'm not going to name the particular CE venue, but um, you know, those sound like great topics, but unfortunately, nutrition is our least attended or most
Mm.
poorly attended topic at the conference. So we're not dedicating as much time to it. And so we have our colleagues out there who are drowning and feeling like they don't have the tools that to have the really complicated nutrition conversations. But yet then where are they going to get it, right? There are a lot of the vet schools don't have a nutritionist. They don't have non-branded courses, and not saying the branded ones, there's anything wrong with them, but we're just
Mhm.
not like, where are colleagues going to get it from? And do you feel like, is that
Mm.
accurate to say that nutrition is the most least attended or most poorly attended
Yeah.
topic at a
I don't
conference?
know. I don't have that knowledge, and I mean, whoever's saying that, I probably trust it, but I think
Yeah.
there's so much there's so much that goes into how you're gonna get a butt in a seat,
Mhm.
and, there I mean, there aren't, that I can think of, like, big time board certified, veterinary nutritionist celebrities. So, we have that in surgery, we have that in dermatology, we have that in dentistry, we have that in emergency medicine, all that kind of stuff. And so, a lot of people are drawn to those. And I'm not saying that there's anything bad with that because they're
Yeah.
usually very good talks, very
Mhm.
entertaining, and people get stuff out of them. But as far as when there's 17 talks the same hour, and one's on preventing struvite or something like that. I think they're probably, yeah, I've probably had that 10 times. So I'll go on to something else that I haven't heard before. But there's so many. I think I've seen and I've heard that when there are some of the controversial type things as far as grain free or raw diets and the
Mhm.
pros and cons of these and that. I think people are attracted to those. So I think a lot of it's just getting a company that's putting on CE to go out on a limb a little bit, which they don't, like you said, they don't like to do. They like to know it's gonna people are gonna buy tickets if they put this person or this topic up. But somebody's got to be the one to say, I think this is important, and let's figure out how to put a title on there, get a hook to it, and take a chance and promote it and get people there because it's important. So I don't think it's just a nobody wants to learn about nutrition or they think they know it all. I think it's a
Mhm.
lot more complicated than that
Yeah.
in the CE world, and but I don't know how to to tackle all those different variables.
And to AVMA's credit, I put in an application to speak for them and they accepted it. That will be the next conference that I'm speaking
Oh,
at. And it's
fantastic!
about dragons. So I will be talking about the dragons of the nutrition world and how to either be burned by them or to learn how to ride them. And
That's and see that it's all in a title and it's all in a that sounds, huh, I wonder what that's about. I'll go check that out. And I think that's fantastic. That well done on that title. Um, well, I'll as with my AVMA role, I'll definitely be in DC this summer. So we'll have to find time to see each other in person there because I'll be there for like 8 days.
oh wow.
It's I know it's it's a lot. We've got board meetings, then I've got House of Delegates meetings, then I'll be speaking, and then I have to sit in on all the SAVMA House of Delegates meetings, and
Mhm.
they're all like
Mhm.
2 day chunks of everything. So it's a it's a long week. I'm pretty exhausted by the end of that week, and I get energized by being around people, but that's a lot.
Yeah, that's a lot and a lot of where you have to really be on. You can't just sit back and enjoy the people. You really have to be
Yeah.
driving it, driving the ship. Yeah, I'm making a lot of boat references. I haven't, I'm really not an avid boater.
Uh, yeah. Well, that's not as far for you to just pop down the coast to be in the same time zone.
No.
That's good.
Yeah, no, I'm very close. Yeah, I'm very close to coastal Massachusetts, so I could, if I had a boat, I could pop in a boat.
There you
Uh,
go.
yeah, and go sailing. When the weather's a little bit nicer, it's still quite. Actually, it was snowing today, so
Oh,
no desire to
no way.
pop in a boat today.
It's supposed to be spring.
It really is, and hopefully it will get to be spring again. It was 60s in the 60s a couple days ago, so hopefully we'll get back there again soon.
Yes, it will. It will happen. We know it will.
Yeah, absolutely. Well, thank you so much for taking the time out and coming to
This has been
talk with
fun.
us today. We didn't get that weird. I feel like maybe, we'll have to do it again, and next time we'll try to get weirder.
Okay. Okay. I like it. I like it. Yeah, Sarah and I will invite you on to It Might Get Weird, the podcast, and we'll talk about maybe nutrition in vet school and how that can be and who's doing it well and who's not,
Oh,
and maybe we'll really ruffle some feathers.
amazing. I love having that conversation because I feel like I've finally figured out how to do it in a way that, I mean, it always ruffles feathers, but in a way that it isn't shaming. It isn't shaming
Of
and
course
I
not.
like
Yeah.
having that conversation because it's not as simple as it's nobody's fault, right? It's just times have changed, and we need to find a way to adapt with the times and how to have that happen in academia. And in
Yeah.
academia, change happens slowly. And what can we all do, and what part can we all play to help our academic institutions implement those changes? And so, yeah, I'd love to have that conversation.
Great. We'll do it.
Absolutely. Well, thanks so much.
Thank you. See you later.
Bye bye.
Bye.